Okay, we're almost live. Three. Okay. We are. Ahora sí, live.
All
We are
right,
live.
we are live. Hello, everybody. Dr. Garrett Wegerif here at Pure Plastic Surgery in Miami, Florida. I am a double board certified plastic and reconstructive surgeon. Come check us out at pureplasticsurgery.com. You can get a bunch of information online. You can see before and after pictures. You can start the consultation process to get pricing for all the different procedures we offer. Today we're going to be discussing breast augmentation and specifically implants and some common questions that we get about the implants that we choose. So jumping right into it, am I a candidate for breast augmentation with silicone implants? Bottom of the line is most people are a candidate for some type of augmentation with saline or silicone implants. Some people need additional procedures in addition to just the augmentation. Some people need a lift to reposition the nipple. The only person that might not be a candidate for silicone implants are very young patients. All the studies that the FDA did with silicone implants were actually on patients 22 years and older. So all the FDA recommendations for silicone implants are actually for 22-year-olds or above. I think it's kind of a silly thing, and it was just the arbitrary age that they chose to do the studies with. We use silicone implants all the time for reconstructive purposes for patients less than 22 years old. According to the FDA, that's a recommendation that you should be over 22 to get silicone implants. You can still get saline implants at less than 22 years old. And there's some circumstances, if you have a congenital breast deformity, where you still may candidate for silicone implants. How long do silicone breast implants last? This is a great question, and it's hard to answer. So basically all the manufacturers of silicone implants in the United States offer a minimum of a 10-year warranty on their implants, saying that they should not rupture before a 10-year mark. If they do, they'll provide some financial assistance for the replacement of those implants. And most of them have a lifetime warranty on the implants themselves, meaning that if they rupture, they can get the cost of the implants themselves, not necessarily the surgical procedure replaced. But in all reality, our technology has been improving year after year with implants, and the amount of time that they're going to last is also going further and further with each new generation of silicone implants. And so in all reality, modern silicone implants, if you're not having any issues like capsular contracture or something else, can last well beyond 20 years. The FDA recommendation again is that 5 years after I place silicone implants, you get either an MRI or an ultrasound to look at those implants to see if there's any sign of a rupture, and then every 2 to 3 years after that. But if there's no sign of ruptures and you're not having any symptoms, you don't need to just arbitrarily change implants at a 10-year interval. And that's something that a lot of plastic surgeons used to say, probably partially out of monetary motivations, because it's an easy procedure to just exchange an implant. But you know, we want to do the right thing for the patient. If you're not having any issues, you don't necessarily need to get just an exchange done. But if you're getting your implants at a young age, they are not going to last forever, and you have to keep in mind that there's some associated costs in the future with either exchanging or removing these implants. What is the recovery time after breast augmentation surgery? It's really a super well tolerated procedure. I do two slightly different types of breast augmentation. One is a submuscular, meaning completely underneath the muscle. And this is great for patients that have very small amount of breast tissue. It helps give a very natural appearance of the breast, because that extra layer of muscle helps blend the line of the implant. This has a little bit more discomfort associated with it, just because you feel the pressure of the implant underneath your muscle. The other type of approach I do is a subfascial approach, which means the fascia is the thick connective tissue on top of the muscle. I go right below that and above the muscle. The recovery for this technique is super well tolerated. Most of my patients really don't even require narcotic pain medication. They're switching right over to Tylenol and ibuprofen, a day or two after the surgery, and really requiring minimal narcotic pain medication. Are silicone breast implants safe? Yes, they are very safe. They've been studied for a long time. There was a short period of time back in the late 90s, early 2000s when they were removed from the market. And again, the technology of these implants has improved significantly from what they were back then. Both saline and silicone implants have the same silicone shell on the outside. The difference is what they are filled with. So the saline implants are filled with salt water. If you get a rupture with one of those implants, you get a flat tire. You're gonna notice, within hours if you have a significant rupture, because you're gonna notice your breast deflating. The silicone implants, they're not going to do that because they're a cohesive gel, meaning they act almost like a gummy bear type consistency. If there's a rupture, they actually are shape and form for the most part. And you may not recognize that you have a rupture. That's why you need to get the additional imaging like an MRI or an ultrasound 5 years after I place the implants, and then every 2 to 3 years after that. Can I breastfeed with silicone implants? Absolutely. So with both of the approaches I do for my augmentation, whether it be submuscular or subfascial, we're not cutting through any of the glandular breast tissue. We're not cutting through any ducts. So there's no mechanical reason you would not be able to breastfeed after having a breast augmentation, especially with the approach I do using the incision in the fold of the breast rather than around the areola. With that being said, there's a percentage of women that have difficulty breastfeeding that have never had breast surgery. So it's hard for me to predict 100% if you're gonna have any difficulties breastfeeding, but there are no reasons that the implants themselves or the surgery itself should cause a mechanical problem preventing you from breastfeeding in the future. What size silicone breast implant should I get? And this is what really comes down to your relationship with your doctor and a thorough consultation and you understanding what your goals are and what you want to achieve out of your breast augmentation surgery, and then just some of your anatomic limitations. If you're coming to me and you're a skinny petite girl and you have A cups, we're not going to be able to throw 600cc implants in there. It's really based off of two main things. One is the width of your native breast tissue. This is the main thing that I use to help guide me in guiding you and choosing the right implant. The next thing is the profile of the implant that we are going to use. So different profile implants mean that for the same diameter implant, they project a little bit further as we go up in profile. And this is really where you have more say in determining what you want out of your breast augmentation. So obviously as we go with a fuller, higher profile, it's going to give a little bit more of the augmented look versus a more moderate profile implant is going to lead to a more natural look. And so next question, do silicone breast implants feel natural? Yes, I always recommend silicone implants to my patients. It's 99% of what I place because they look more natural, they feel more natural. And again, as that technology has improved, they're getting even better and better. And some exciting news here at Pure Plastic Surgery, we actually just got the 6th generation breast implant from a company called Motiva. And this is a very unique breast implant that has a super soft, natural feel, but it also holds its shape very well. And it has a remarkably low risk of capsular contracture. So this is a new offering that we have here at Pure Plastic Surgery, and definitely something that I'm excited about using. They have some great technology behind it. With that being said, Allergan, the ones that I've been using for years and years, are tested and excellent implant that I've used hundreds and hundreds of times, and I really like the results that the Allergan product presents as well. But we have a few different options that we can discuss further when you come here for your consultation. With that being said, we covered a lot of information. Do we have any questions from anybody?
Yes, we have a question right here, and it's about a tummy tuck. And
yes.
Jaji, she asked, where is the incision place for the tummy tuck? Is hidden when you wear swimsuits?
Absolutely. So I take a lot of time to make sure when we're marking in the pre-op area that we're going to place the incision where you wear your underwear, because people have different styles of how they wear their underwear. Some women wear them really high and they want that incision to curve up to be covered by their swimsuit or their bikini when they're out at the beach. Other people just want it as low as possible, and so we're going to have a discussion about that. I can help tailor that to your exact needs and desires. All right, everybody, thank you for tuning in. I appreciate it. Check us out at pureplasticsurgery.com, and I will see you next week.
Okay, thank you, Doc. Boom.